Vomiting in adults is the forceful expulsion of stomach contents through the mouth. It is a common symptom and can occur due to a variety of causes, ranging from benign conditions like mild infections to more serious issues like gastrointestinal disorders or neurological problems. Vomiting is often accompanied by nausea, which is the sensation of wanting to vomit. Causes of vomiting in adults. Vomiting can be triggered by a wide range of factors, including 1. Gastrointestinal causes. Gastroenteritis, stomach flu infections caused by viruses like norovirus or rotavirus or bacteria like Salmonella or E. coli can lead to inflammation of the stomach and intestines, resulting in vomiting, diarrhea, and abdominal cramps. Food poisoning. Consumption of contaminated food can cause foodborne illnesses that lead to nausea and vomiting. Gastroirritation. Conditions like gastritis, inflammation of the stomach lining, peptic ulcers, or acid reflux can irritate the stomach lining and trigger vomiting. Indigestion. Dyspepsia, poor digestion or overeating can cause nausea and vomiting. Gastroesophageal reflux disease GERD. Stomach acid moves backward into the esophagus, leading to irritation, nausea, and vomiting. Obstruction of the gastrointestinal tract. A blockage in the intestines due to conditions like hernias, tumors, or adhesions can cause vomiting as the body tries to expel the contents of the stomach. 2. Neurological causes. Migraines. Severe headaches, often accompanied by nausea and vomiting, can be triggered by various factors, such as certain foods, stress, or hormonal changes. Concussions or head injuries. A blow to the head can lead to nausea and vomiting as part of a concussion or traumatic brain injury. Brain tumors. Tumors in the brain can increase intracranial pressure, leading to vomiting, headaches, and other neurological symptoms. Vertigo. Conditions like benign paroxysmal positional vertigo (BPPV) or Meniere's disease can cause dizziness, nausea, and vomiting due to balance issues. Intracranial pressure. Any condition that raises pressure in the brain like hemorrhage, infection, or hydrocephalus can cause vomiting. 3. Systemic causes. Pregnancy. Morning sickness. Hormonal changes during pregnancy, especially in the first trimester, can cause nausea and vomiting. Metabolic and endocrine disorders. Conditions like diabetic ketoacidosis, adrenal insufficiency, Addison's disease, and hypoglycemia, low blood sugar, can lead to vomiting. Liver disease. Conditions like cirrhosis, hepatitis, or liver failure can cause nausea and vomiting, especially when toxins accumulate in the body. Renal failure. Kidney failure can lead to the buildup of waste products in the bloodstream, causing nausea and vomiting. Electrolyte imbalances. Low levels of key electrolytes such as potassium or sodium can lead to nausea and vomiting. 4. Medications and toxins. Chemotherapy. Chemotherapy drugs used to treat cancer often cause nausea and vomiting as a side effect. Painkillers. Some medications, such as opioids, can irritate the stomach and cause nausea and vomiting. Antibiotics. Certain antibiotics, especially broad-spectrum ones, can disrupt the gastrointestinal tract and cause vomiting. Alcohol. Excessive alcohol consumption can irritate the stomach lining and lead to nausea and vomiting. Toxins and poisons. Ingesting toxic substances or drugs can result in vomiting as the body attempts to expel harmful substances. 5. Psychological causes. Anxiety. Emotional stress or anxiety can sometimes lead to nausea and vomiting. Bulimia nervosa, an eating disorder characterized by binge eating followed by purging, which often involves vomiting. Psychogenic vomiting. This refers to vomiting that occurs without an underlying medical cause, usually due to psychological factors. 6. Other causes. Motion sickness. This occurs when the brain receives conflicting signals about motion, leading to nausea and vomiting. It can be triggered by travel, particularly by car, boat, or plane. Food intolerance or allergies. Some food allergies, e.g., to shellfish, nuts, or intolerances, e.g., lactose intolerance, can cause nausea and vomiting. Overeating or eating too quickly, overloading the stomach can lead to discomfort, nausea, and vomiting. Symptoms associated with vomiting: nausea, the sensation of needing to vomit, often preceding actual vomiting. Abdominal pain, vomiting may be accompanied by stomach cramps, bloating, or discomfort. Dehydration, excessive vomiting can lead to fluid loss, resulting in dry mouth, dark urine, dizziness, and weakness. Fever, a fever may accompany vomiting if the cause is related to an infection, e.g., gastroenteritis or pneumonia. Blood in vomit, vomiting blood hematemesis can indicate a serious issue, such as a bleeding ulcer, esophageal varices, or gastrointestinal bleeding. Green or yellow vomit, this could indicate bile, which is common in cases of intestinal obstruction or after vomiting in excess. Diagnosis of vomiting: the diagnosis of vomiting often begins with a detailed medical history and a physical exam. Your healthcare provider will ask questions about the onset and frequency of vomiting, any accompanying symptoms, such as fever, pain, dizziness, or changes in bowel movements, medication use or any potential exposure to toxins or infectious agents, recent head injuries or any signs of neurological issues. Additional diagnostic tests may include blood tests to check for signs of infection, liver or kidney problems, dehydration, or metabolic imbalances. Imaging, X-rays, CT scans, or MRIs of the abdomen or brain to check for conditions like gastrointestinal obstruction, brain tumors, or other structural problems. Endoscopy, a procedure where a flexible tube with a camera is inserted into the stomach to look for ulcers, inflammation, or tumors. Urine tests, to check for dehydration or kidney problems. Electrolyte tests, to monitor any imbalances that may result from vomiting or other conditions. Treatment of vomiting: the treatment for vomiting depends on the underlying cause. General approaches to managing vomiting include 1. Rehydration: oral rehydration solutions, or these are used to replace lost fluids and electrolytes. Intravenous IV fluids: in cases of severe vomiting or dehydration, IV fluids may be required to restore hydration and balance electrolytes. 2. Medications: anti-nausea medications, drugs like ondansetron, metoclopramide, or promethazine can help reduce nausea and vomiting. Proton pump inhibitors (PPIs) or H2 blockers, for conditions like acid reflux or gastritis. These medications can help reduce stomach acid and alleviate nausea. Antibiotics: if vomiting is caused by a bacterial infection, e.g., food poisoning or gastroenteritis, antibiotics may be prescribed. Antihistamines: these can help if vomiting is related to motion sickness or vertigo. 3. Dietary changes: eating small, bland meals and avoiding spicy or fatty foods can help reduce the likelihood of vomiting. BRAF diet: bananas, rice, applesauce, toast is often recommended for those recovering from vomiting due to stomach illness. 4. Treatment of underlying causes: for gastrointestinal infections, anti-inflammatory drugs, or specific antiviral medications may be necessary. Surgical intervention: in cases of intestinal obstruction or other serious conditions, surgery may be needed. When to seek medical attention: you should seek immediate medical attention if vomiting is severe, persistent, or uncontrollable. There is blood in the vomit or it appears like coffee grounds. You experience severe abdominal pain. You have signs of dehydration, such as dry mouth, dizziness, or very little urine. You develop neurological symptoms, such as severe headache, confusion, or difficulty walking. Vomiting occurs after the head injury or trauma. Prevention: to prevent vomiting, avoid contaminated food or water to reduce the risk of infections. Eat in moderation and avoid overeating or eating too quickly. Avoid trigger foods if you have known food intolerances or allergies. For motion sickness, consider taking anti-nausea medications or using natural remedies like ginger before traveling. Manage stress or anxiety to prevent psychological causes of vomiting. Conclusion: vomiting in adults is a common symptom that can result from many causes. While it is often self-limited and resolves with supportive care, hydration, rest, anti-nausea medications, persistent or severe vomiting should be evaluated by a healthcare provider to identify and treat the underlying cause. If you experience additional symptoms like fever, severe abdominal pain, dehydration, or blood in vomit, seek medical attention promptly.